Well, hello and welcome to all of our viewers here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, today I'm very excited. We are talking about our upcoming conference here at Gold Learning, and it is our time for our Gold Obstetrics Conference. You can find out all the details, of course, on our website at goldobstetrics.com, where you'll be able to register for the part of the free events that are coming up at Gold Obstetrics, and of course for the full conference as well. Now, as part of our full conference, we have our special guest here with us today, Sally Collins. Welcome to Gold Obstetrics.
Hello.
It's great to have you here.
Hi.
Sally, I would love it if you would just share a little bit about where you are in the world and, of course, what you do on a day-to-day. Tell our audience what's happening in your neck of the woods.
Thank you, Fiona. I am a consultant obstetrician at the John Radcliffe Hospital in Oxford, and I work within the specialised field of Placenta Accreta spectrum. I'm also an associate professor of obstetrics at the University of Oxford, with the majority of my research being in intrapartum care and placentology. So that's mostly imaging of the placenta, the first trimester placenta, looking for predictive value within the imaging of the first trimester placenta for growth restriction and preeclampsia. But I also work very significantly in Placenta Accreta spectrum. I run the big tertiary referral centre for the Thames Valley, which is a catchment area of about 3 million women here in the southeast of England. And I work with NHS England, and I'm also vice chairman of the International Society for Placenta Accreta Spectrum. So I think I'm an all-round placenta nerd.
I wasn't gonna say it first, Sally, but that's where I think that's where we're going with this. Well, first of all, congratulations. I mean, you're fully immersed, it seems, in all things placenta, which is amazing and wonderful. What I'm gonna ask you though is about placenta and the research behind it and what is happening in that field. Is it a large field of folks that are immersed in it? Is it still very small? Like, do we give a lot of credit to the placenta today in terms of part of, an organ as part of the biological reproduction? What is happening in that element?
The placenta is the most indispensable disposable organ you ever had. And in my opinion, there is definitely not enough research in this field. Placentologists worldwide, we're quite a small group, quite a niche group, but we've got everything from trophoblast biologists, immunologists, clinicians working in that field. The reason the placenta is so unbelievably important is it is the baby's life support machine. What the placenta does for that baby while they're in utero actually ensures the child lives a long and full and happy life. We know that if the placenta doesn't function well, not only can the woman have preeclampsia, but if the baby is growth restricted, the after effects of that growth restriction lasts a lifetime. Being born small isn't just a case of being little and having to catch up with your growth. The fetal programming that occurs in utero puts babies who are small at risk of heart disease, type 2 diabetes, cardiovascular events, obesity for the rest of their lives. And this has been known for a while. The Barker hypothesis of the placental growth and the fetal programming is a growing field, because we're realizing that if the placenta can have such profound effects on fetal growth and the lifetime of that child, if we can somehow manipulate the placenta to function better,
Right.
We have the chance to change the life course of the offspring and potentially reduce, like I said, obesity, cardiovascular disease, and improve the health of that individual throughout the course of their adult life. So it is a massively important part of pregnancy, which is quite often forgotten because
Yeah.
people are so focused on the fetus that they forget
Mm,
that without a placenta, the fetus will not grow, will fail to thrive, won't survive. And as a result of that, we're not only working on understanding it better, but actually working on different ways to manipulate the placenta to make it perform better.
absolutely. And I think what I hear you saying is that we need to learn how not only to grow a healthy baby, but to grow a healthy placenta because they're really tied as one. I mean, we're dependent on, both to work alongside each other. It just seems like the placenta hasn't been given enough exposure in research today, and maybe even been given a little bit of a bad rap as not being as important as needed or necessary. But it is the life source completely, right, Sally?
I would definitely agree with that. Without a healthy placenta, you cannot have a healthy fetus. It is the baby's life support machine. It's the baby's lungs. It's the baby's organ of excretion. It works as an endocrine organ. It is massively important. And the issue that we have with the human placenta is it's a completely unique organ. By its nature, it's invasive. We
Hmm.
have no good animal models for this. The human
Interesting.
placenta is very, very different. The closest we have to the human placenta is the great apes. And as
Hmm.
you can imagine, that they're not very useful within research because we don't experiment on great apes.
Right.
Um, we have non-human primates, but they have very different placentas. A lot of placental research has been done in marmosets, rhesus macaque monkeys, but their
Hmm.
placentas, whilst fairly similar, are
Mm,
still very different. So
right.
we're very much in the dark because we lack an animal model for this. We can try and generate animal models of preeclampsia. We can generate nutritional models of fetal growth restriction. We can
Hmm.
tie off the blood supply to half the placenta in an animal model to generate an animal model of growth restriction. But nothing truly represents the human placenta except the human placenta. And
Right.
that's where it's so difficult, which is why we fall back so resoundingly on postpartum analysis of the placenta
Right.
and on imaging techniques. And this is
Yes.
where improving imaging techniques is really leading to improvement in our understanding of the placenta. Now, a few years ago, the NIH in North America launched the Human Placenta Project,
Hmm.
which has been amazing. It's been absolutely fantastic for pushing forward research into novel methods for imaging, novel methods for monitoring in real time
Hmm.
the placenta, the placental development. And we were lucky enough to be funded with part of our imaging research via the Human Placenta Project. But more is needed, very much more, in order to understand the origins of health and disease that comes from the fetal programming from the Barker hypothesis. And of course, like you say, it's an organ which is entirely dismissed.
Mm.
As far as I'm concerned, I think it's the most beautiful and amazing organ that the human body ever created. It's generated in 9 months. It is a temporary organ. It's fully disposable. But if it malfunctions, you have all sorts of bad pregnancy outcomes, from
Mm.
stillbirth to growth restriction, abruption, preeclampsia. And like I said, it's an absolutely vital organ, and I think it's never been given the credit it deserves. It's been referred to as the afterbirth. It's
Yeah.
an afterthought, and in actual fact, it should be the pre-birth. It's the most important part of pregnancy, as far as I'm concerned.
Absolutely. I can't remember the last time someone came to me and said, "How do I grow a healthy placenta?" And so it just goes to show
Yeah.
we need to change a lot of our language in how we're treating patients and educating them in what they need to know about their own bodies. So I mean, I'm truly excited that you are a nerd. I love it. I know that we've got a long ways to go, but hopefully through some of your work and research and some of your other cohort fellowship there, that we're beginning to see this rise to the top. Let's talk briefly about what's coming up here at Gold Obstetrics. You're going to be talking about something too that I also find so interesting about placenta accreta. And I first saw this in a healthy woman who had not had any previous pregnancy. So it sort of came as a bit of a shock. But you talk about the whole spectrum. When was this project that you became interested in, Sally?
Oh, I became interested in this as a junior doctor a long time ago when we had a woman who'd had several previous cesarean deliveries, and
Hmm.
she presented to us with a placenta accreta, which is the worst end of the spectrum. And there was very little in the literature that I could go to truly work out how to diagnose it, having not seen
Mm,
it before. We have a relatively low cesarean section rate in the UK, so fortunately this isn't a pathology that we come across as often as countries that have a high cesarean rate,
sure.
but it is rising. It is
Hmm.
rising in the UK, it is rising worldwide. The problem with it is it's a spectrum. It's
Mm,
been reported in the literature as a binary outcome, which is
mm,
absolutely crazy. That's like saying someone has cancer or doesn't have cancer. In actual
right.
fact, what's vital is the staging of their cancer, where it's
Hmm.
at. And placenta accreta spectrum is the same. It's taken us coming up 15 years to even get the world to decide on a name. It
Wow.
used to be called morbidly adherent placenta, abnormally
Hmm.
invasive placenta, placental adhesive disorders, hundreds of different names. It was
Mm,
defined in different ways. It didn't have a method for unifying the diagnosis. And so consequently, and of course it's rare. It's
right.
tragically growing, but it still remains a very rare condition. So the problem we've had is this is a rare condition. It jumps up. It can kill women,
Hmm.
unfortunately, but it also is responsible for massive morbidity, both from catastrophic blood loss, but also from the damage that can happen when we try and do the hysterectomy to treat it.
Mm,
Women end up with lower urinary tract trauma and other trauma. And there just wasn't enough out there that could really unify this. So myself and quite a few other people who had an interest in it really started looking into it. And from this, the International Society of Placenta Accreta Spectrum was born.
right.
Originally the European Working Group, and it involved about a dozen European clinicians who all got together and said, if we're going to get better at this, we have to share. We have to
Right.
share our experience, we have to share our data. And we all started getting together and meeting regularly. And we realized the biggest problem with the research in this field is nobody was defining it. Nobody was diagnosing it correctly. It had no clinical stratification. If you were approaching breast cancer the same way, you would be laughed out of the literature. How do you
Mm,
know it's breast cancer? Well, it is just because I say it is. I mean, that would never happen. There is
right.
staging, there is grading, there is classifications. None of that existed. And
Wow.
so consequently, it was almost impossible to work out the best way to diagnose it. It was almost impossible to work out the best way to manage it. And we started about 10 years ago saying this has to change. We need to
Hmm.
tackle it. And since then, we've grown into a worldwide organization. We've been taken up by FIGO, Safer Motherhood Committee, so that we can actually try and guide the world in
Right.
the diagnosis and appropriate classification of this system, so that we can help people coming along who may have never seen one.
Hmm.
We can help them diagnose it, we can help them manage it, and we can set up proper ways of recording the cases so that we can compare the pathology and methods for managing it.
Mm. Wow, so much. Well, there's a lot going on in this area and definitely needed. As we can hear from you, Sally, this is excellent work that is happening, but it's taking time. And it's taken
Always
an
does.
immense amount of time to get to where you are today. But we certainly appreciate that you're going to be here with us at Gold Obstetrics to share on this topic. And again, placenta accreta spectrum, the rise of the iatrogenic killer, is what Sally Collins is going to be talking about at our conference. Thank you so much, Sally. It's just been great chatting with you. I know we'll have more opportunity to hear your presentation as well, and I can't wait for everyone else to hear it. So thank you for joining us here today.
Absolutely my pleasure, Fiona. I could bore for England on placentas, so I'm delighted to be here with you.
Excellent. Well, thank you once again. And to all of you listening in, don't forget to head over to our website right now to catch not only this presentation, but many more as part of our Gold Obstetrics 2020 conference at goldobstetrics.com right now to check out all the schedule. Thank you so much for joining us here today. Bye bye for now.
Bye-bye.